Well, hello, everyone. My name is Darren, and I am one of the marketing coordinators with BCIT's School of Health Sciences, one of the 6 schools within BCIT. And it is my pleasure to welcome you to this online information session for the Health Leadership Advanced Certificate Program. I want to say, first off, how happy we are for you to all join us tonight. And just before we get going, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. And now I'd like to call up Shan Satterglue to introduce the department and speak about the program. Are you ready, Shan?
Yes, I am. Hi, everyone.
Excellent.
My name is Shan Chataglu. I'm the program head of the Healthcare Management Department at BCIT. I've been a faculty member here for about 20 years and started at the time when e-learning was really taking off as part of the post-secondary ecosystem. My role as the program head is to administer the program, counsel students. I also teach, and I'm involved with applied research at BCIT. So our department, we inspire and educate health leaders who wish to develop their leadership and management skills to foster a positive change in the health system. So this is the format for this evening. It is intended to be interactive. So we will do a bit of sharing, as you'll see. We call this roundtable discussion. We're not going to be verbalizing and speaking so much, but we will be sharing some information in the chat. So I'll be asking you to share a little bit about yourself when we get to that. And then I'll be giving a kind of a short presentation, and then we'll have about 10 minutes at the end for Q&A. So looking forward to hearing your questions, learning more about you, and also the Q&A that happens towards the end. So let's start off with the roundtable piece. If I could ask each of you for a favor, could you briefly post your role and your academic background and your location into the chat? Don't need to type your name, don't need to say anything personal about yourself, but just some information that we can share among those who are here that we can kind of have a discussion around that and how that relates to the program. And I will do the same. For those of you who are in the workplace and maybe not able to type into chat, that's totally okay too. It's I understand that people have many different activities during their day. So let's get a little post into the chat. Okay, let's see what people are posting. Okay, interesting. Mamta, thank you for your post. Patrick, thank you. See some others are being typed. Interesting. Okay, good, great. So we have some with kind of technologist backgrounds in medical laboratory. We have some from the pharmacy sector, dentistry, overseas clinical practice, internationally trained health professionals. We have some involved in program administration associated with academic institution, a BA Health Sciences in SFU, very good. Let's see what else we got. Clinical coordinator of nursing and medical imaging RCH, excellent, great, great, thanks for sharing. And I think everyone can also see the chat. It is really interesting to see the range of people's backgrounds who's interested in a program like ours at BCIT and health leadership. I'll be commenting more on that from the perspective of diversity, but also from the perspective of interprofessional teams and transforming healthcare. So we'll come back to that later on. Thank you all for sharing a bit about yourself. Okay, Darren, can we go to the next slide, please? Okay, so this is a vision statement from our Department of Health Sciences, our Healthcare Management Department in the School of Health Sciences at BCIT. Our belief is the future of healthcare is going to be much more patient and family-centered than it is in the past and more than it is today, with greater emphasis on health promotion and preventing of illness. Kind of a shift from the hospital and acute care sector towards more community-based, more focus on accountability, value for money, the involvement of professionals working in patient-focused teams. And because of demographic shifts, likely there'll be an older population. So these are some of the mega trends that we, I mean, it's in the literature, but these are some of the mega trends that we are anticipating and incorporating into how we do teaching and learning in our program and really what our program is for. You might want to think about your own roles, especially if you're kind of at that emerging stage of a career. As the system changes to this new reality, who are going to be the clinical and non-clinical leaders in this future health system? If you're, you know, a highly trained health professional, you've got some stake in your skin in the game in terms of being part of the emergence of the new health system, and sometimes advancing your abilities in terms of leadership and management is a way to participate in that journey and to contribute. Next slide, please. So in Canada, we're very proud of our health system, a national health system with provincial health systems. We often compare ourselves to the United States, and that gives us confidence. But on an international scale, we're not really the best in the world. If you look at this table published by the Commonwealth Fund, a ranking of health systems internationally, you can see that Canada is not really at the top. It's a little lower on the list. So in this case, in this 2021 report, we're number 10. Just below us is US, and then going up higher than Canada on the rankings are the Scandinavian countries. So certainly there's room for improvement. You can see some of these categories like access or equity. There are room for Canada to improve. Next slide, please, Darren. So the same sort of chart presented in a kind of a slightly different way. In terms of higher performance, Canada is certainly not above the 10-country average. And in terms of spending, we're kind of, it looks like we're kind of in the middle, with US being way, way above the middle. Next slide, please, Darren. Another way to look at system priorities and areas for improvement is to look at your regional, your provincial, state, or national priorities in healthcare. And for us here in BC, it's public information. Any of us can go and look at the BC Ministry of Health Services plan and just take a snapshot any particular year and look at, you know, what are the key goals and objectives for the next 3-year period. One way that's kind of a handy shortcut, a heuristic to assess the importance of goals is looking at, you know, which goals are stated first, what comes second, and what comes third. So prioritizing according to the sequence, and also just the amount of space that's taken, the amount of attention that's given to particular goals. So in this case, goal number 1 from here in British Columbia, ensure a focus on service delivery areas requiring strategic positioning. So like what was said earlier, moving towards a kind of an integrated team-based care, focusing on primary care, emphasis on seniors, emphasis on mental health and substance abuse, timely access to really important procedures and tests. Goal number 2, focusing on the health and well-being of British Columbians with high-quality services. So kind of going upstream in this case, looking at population health, injury prevention, and health promotion. And downstream, making sure that the necessary pharmaceutical, laboratory and diagnostic services are available, functioning, and high quality. And then goal number 3, looking at sustainability, making sure that there's a good value for money in terms of resources, sustainability in terms of people. So the health human resource challenging, trying to address issues of burnout, addressing issues of succession planning, And also thinking about, in terms of a kind of a secondary benefit of having such a really important and large sector of the economy focusing on healthcare, how can we use these really important activities also to come up with new innovations for new products and services that can be used and marketed to other countries? So these are three large goals from this services plan as a snapshot in terms of priorities. So why go and look at this sort of information in an introductory roundtable session on health leadership in terms of education? Well, as emerging health leaders, it's important to align your interests with some of these large movements that are happening, and to make sure that your abilities to contribute is in the direction that will be supporting a future health system. And so having this kind of environmental scan is important to you as emerging leaders interested in this field in healthcare. So next slide, please, Darren. Okay, so I've used the word leadership a few times here. Here's a quote that I think is a little comical. It's by Warren Bennis, who's a very well-known scholar, organizational theorist of leadership in the 80s. This is a quote from him. Leadership is like the abominable snowman whose footprints are everywhere, but is nowhere to be seen. So kind of a tongue-in-cheek comment about leadership. Next slide, please, Darren. So if you take the word leadership and you look it up in Amazon.com or Google Books, or just go up and down the bookstore, you will see so many definitions of leadership, from quantum leadership to real leadership, leadership for healthcare, absolutes of leadership. We are all leaders, leadership secrets from, this or that. So the term is used very in popular culture, as well as in scholarly or academic or business or corporate culture. So in many, many different ways, it could be pretty confusing. Next slide, please, Darren. Here's a definition that I particularly like, and this is my own personal sort of interest. Leadership is accepting responsibility for enabling others to achieve shared purpose in the face of uncertainty. So this is kind of what leads us to our topic today, health leadership at BCIT. So healthcare management as a department in the School of Health Sciences has been teaching leadership and management for quite some time, from the early 80s. In the early days, we had two certificate programs that were offered in a weekend model. So back in those days, people used to take time, to study maybe 2 full days in the midst of other things. In around 2000, we launched a number of new online programs related to health administration. So clinical research administration, health informatics, and quality improvement. This was a time when e-learning was really taking off, and this is when I started at BCIT. A lot of the material that used to be done in classroom format or in correspondence paper format, where you do 2 essays and then you write an exam, kind of moved over to the online space. And at that point, we started to involve much more participation in learning, but being able to do it in a flexible way so that you didn't have to show up on a weekend. You can kind of blend it in with your workplace. And then in 2013, we decided to kind of integrate our studies and identify what are the essential learnings that are really pivotal and underpinning these different areas. And we launched a Health Leadership Advanced Certificate in 2013, and that's our flagship program today. So in terms of kind of who are in the program, this is a pie chart showing the distribution of our current students based on their academic background. So you can see on the left side, There are a variety of disciplines related to health sciences areas, so Diploma of Technology in Health Sciences, like those that we have in our school, laboratory, various imaging domains, and so on, as well as people with baccalaureate training in health sciences, like, for example, one of you who was coming from an SFU background. And then on the right side of the pie chart, you'll see some of the professional degrees. So BSN in nursing, also specialty nursing. And then also graduate level, people who are trained at the graduate level. So MSc, MSN, nurse practitioner, MA, MPH, and so on. So quite a mix of academic preparation in our program. Later on, I'll speak about entrance requirements. But this gives you kind of a sense of, if you look around the room, the virtual room, who's in the class. So in terms of disciplines, occupations, and professions, here you'll see the specialties that are in blue. These are actually the domains that BCIT graduates our undergraduate students into. So for example, nursing, X-ray, MRI, med lab, clinical genetics, diagnostics, sonography. So a lot of the people who come out of BCIT for their first credential can come back to BCIT to continue in health leadership. The other areas that you see here in red, these are professions that we don't really teach into at the undergraduate level of BCIT, but are taught into at other institutions, graduate, enter into the field, and then arrive at our doorstep to learn about health leadership. So people with backgrounds in public health, pharmacy, quite a bit in the area of pharmacy, actually. People who are involved in health informatics, IMIT, social work, long-term care, and a variety of other domains. But what's really interesting to see here is the range of professions. Oftentimes in one's undergraduate studies, it's really important to identify with your profession. So the topics are all inside the professional area, and you socialize with peers and classmates who are kind of training to do the same thing. You kind of go through the school of hard knocks, the crucible sort of learning experiences with people who are just like yourself, even maybe the same age. But in the second and third credentials, after that stage of sort of life, it becomes much more diverse because people are at different stages, different professions, and it's really important to learn to work with and through others. Our students are around mid-30s, a little higher than that, plus or minus quite a bit. So this is just a way to illustrate that, it was really important to get one's first credential done so that people can enter the field and start a career, kind of get life going. But in terms of lifelong learning, there's quite a lot more distance to go in terms of continuing to learn on the job through training, and also applying that to actually transform a system with what you've learned. Okay, so let's talk about the Advanced Certificate in Health Leadership at BCIT. This is what you're here to hear about. So this program is, like I said, was launched in 2013. It's an online program. It's roughly designed around a cohort model, but it's flexible. There are 8 courses that you complete over a 2-year period. That's for 24 credits. The level of study is upper baccalaureate level and a wee bit higher. So the kind of intellectual and scholarly competencies that you exercise in a program like this, or that you need to use in a program like this, is at the upper baccalaureate level. The program is underpinned by a competency profile called Leads in a Caring Environment Framework. For those of you who have kind of a regulated health professional background, I'm sure you're quite aware of there are standards of practice and there are competencies aligned with that are determined by a professional body or an accreditation agency. In healthcare and leadership, it's not quite as refined as that. It's more in terms of frameworks. And the one in health leadership is the Leads in a Caring Environment Framework. After the first 4 courses, BCIT will give you a statement of completion. This is a kind of a symbolic recognition of meeting the halfway point in the program, 4 courses out of 8. It is not an academic credential, but it's a way to sort of acknowledge that you've gotten to the halfway point, which is really important. You can tell your family, tell your friends, your employer that you're halfway there. It's also the opening to mark the second half of your program, where you've got 1 more year left until you do the integrated project at the end of the program, and I can speak more about that. After doing all 8 courses in the program, BCIT will award you the Advanced Certificate in Health Leadership, which is an academic credential of BCIT. It's regulated by our Education Council and our Board of Governors. Entrance requirements. So to get into this program, you need a health sciences diploma or a bachelor degree in any other field or higher credentials with work experience. The minimum standard for English proficiency is 73%, the equivalent of an English 12, and you can demonstrate that through your English 12 or through your university, college, Institute of Technology, English, or a completion of a credential that required that level of study. Just stepping back and from a really practical perspective, what's really essential for success in a program in health leadership is to have relevant, full-time, meaningful work experience where you've gained enough sort of on-the-job learning and kind of socialized to the workplace that you have some discretionary room at work to start thinking about ways to advance yourself. So most students, like I've mentioned before, have a significant number of years of work experience. So they've gotten to that point where they can integrate and start thinking about, given what I've known now, given my original training, what can I do? And they can come with that sort of critical insight and those critical questions that are so important to drive a program like ours, so that people can learn with and through each other with support from BCIT. So the gainful employment in a relevant area of health services or in a different sector with some self-sufficiency that you can apply to work is really important into the program, and as well for your capstone course that comes at the end of the program, which I'll speak about. So the courses, 8 courses in the program, separated into year 1 and year 2. So fundamentals for emerging leaders, addressing questions like, what is health leadership? What does it mean to me? What is my vision for the future? How can I make this work? The second course, Canadian Health System, that's a health policy course. If you came out of SFU's BSc or BEA program, you probably took a course on health policy. Likewise, some of the people with nursing backgrounds might have done this in their undergraduate. Leading health professionals, sustainability in healthcare with a focus on financial sustainability. So that's a financial management course. Performance measurement and management, leadership in evidence-informed decision-making. So for those of you who have a medicine, a dentistry, kind of one of the professional backgrounds in healthcare, you probably did a course on evidence-based practice, how to use clinical biomedical information to improve practice. In this case, the subject matter is health services, leadership and management, and organizational behavior. So it is a different domain. It uses similar sort of concepts of being evidence informed, but the context is a little bit different, and that is actually what makes the course really interesting. Project leadership in healthcare, and then the integrated project that comes at the end. You'll see 3 of these courses have a star beside them in red. This indicates that these particular courses are not only available to people in the health leadership program, but to other programs at BCIT. So they're used as electives in several other programs, as well as required courses in other programs. And for these courses, it's possible to take these ones with the stars without even being in the health leadership program. So it's actually a way to try before you buy, like to try out a course before you go for the program. So in terms of the teamwork, in terms of the teaching and learning methods, we try to strike a balance between individual work and group work. If you're the kind of learner who just give me my 2 assignments. Let me write the exam. Don't want to talk to anybody. If I do well on the exam, I pass the course and I'm satisfied. This is probably not the kind of program for you because this is a program in health leadership. So you're trying to achieve results with and through others. So teamwork is essential. Obviously, teamwork is risky because now your grades are dependent on how you work with others and how others work with you. So there's certainly some risk involved. So we try to have a kind of a sliding scale as people go through the program and they start to develop relationships that they can depend on. Then the team projects become more involved and also you can achieve more. The last course in the program is called the Leadership Integrative Project. This is a really important capstone exercise for the program. It's an opportunity for the learner to demonstrate how they can integrate the learning from the program to a project that's of relevant to the organization. So there are 3 roles involved: the student who acts as a project lead, BCIT, who acts as the academic facilitator to make sure that the coursework of the project meets the requirements and also to help facilitate. And then the organizational / executive sponsor who acts as a sounding board, but also like an authentic client or customer for the work that's being done. The work is not an implementation project, it's a consulting project. So you take your studies from BCIT and look at a problem or opportunity in the workplace and diagnose and come up with some recommendations on how to address the problem based on best practices, based on a variety of diverse sources of evidence, and also what would be politically kind of fitting to the environment. And you do this with the sponsor alongside so they can kind of see how it progresses and so that you have a good fit with the recommendations that are made. There's also a 4th role in this integrator project. We call this invited guests. So this can be a subject matter expert from industry, another BCIT faculty. I could sometimes bring in a colleague to kind of participate as an invited guest, and sometimes patient representatives. So in all, a project like this, a course like this that comes at the end of the program, it gives you a chance to integrate your learning, also to demonstrate your integrated learning with others as participants. So it's a really important stepping stone for getting kind of really strong leverage out of your studies at BCIT. And it can open all sorts of doors. So in terms of what people choose for the integrated project, usually it's from their workplace and usually it's from one of the domain areas that they're familiar with. So some examples of domains are those listed on the left. And in terms of applications, people focus on like improving the workflow of things, process improvements, looking at policies, a program evaluation, which is interesting, healthy workforce. That's kind of a really important issue, and it still is, even now with challenges with retiring baby boomers, fatigue and burnout from after COVID, and just sort of like making sure that the health human resources is strong and healthy. Related to that, training and onboarding. I know some of the technology areas, people are retiring quite a bit, and it's really tough to be able to groom the next generation and to have that sort of organizational knowledge being passed along. So training and onboarding is really important. Some roles in healthcare, there's a lot of churn, so it's not really steady work, but people are kind of coming in and out of roles, and that also makes it complicated. Standards and guidelines, implementing new standards of practice, guidelines like cultural safety and awareness, for example, organizational change, so restructuring organizations involving more patient voice. So these are some examples of applications that people have done for their integrated project. Okay, so here's some a sampling of topics that people have focused on in the past for the integrated project. I'm not going to read these in detail, but if you just look and glance through, you kind of get the sense that topics are very context sensitive. So they're really sort of described in a detailed and specific way. And this is because the projects are coming from where people are situated in their workplace. So for example, towards the right, the second one down, sustainability and spread of PHSA-based physician quality improvement projects. So this was something that a student focused on because it related to their workplace. Just below that one, CT imaging guidelines for pediatrics, for example. So pretty nuanced and pretty specific. And if a person was not already situated in the health system, it'd be hard to come up with a project topic like this, just, as an observer who's kind of fresh and new to the space. So it's really important to have be gainfully employed in the healthcare area and have some experience under your belt so that you can sort of deploy that experience to a project like this, integrating health leadership and then demonstrating what you can do to open doors to the next step. That's why it's an advanced certificate program. Next slide, Darren. And more. So issues of emergency room overcrowding, radiation safety officer training, lean workflows, and so on and so forth. Next slide, please, Darren. So faculty in the program, full-time faculty, as well as adjunct instructors from across the system, masters trained and above, at director level and above, diverse ranges of experience. Endorsements by a National College of Health Leaders and Emerging Health Leaders. And internal within BCIT, quite a lot of affiliations. So the BCIT medical MRI program, the Bachelor of Health Sciences will take the course from Health Leadership as a required course. Same thing in digital health. There's a required course taken from us for that program. Applied data analytics, this is in the School of Computing that takes some of our courses. Technology management based in another school of BCIT, taking a few courses from Health Leadership as well as project management. So there's external affiliations and partnerships as well as internal. So it's a really good, diverse kind of mix of students in the body. In terms of the schedule of program offerings, we design our department so that we offer the same sequence of courses every year. So it kind of rolls over each year. But if you have 8 courses and it takes 2 years to finish, we distribute that over a 2-year period. So for example, if you look at, let's just take this snapshot, this 2023, I know we're in 2024, but taking the 2023 example, you would take the first 2 courses, 7110 and 7120 in the January term of 2023 of the first year. And then in the next term in the April, you'll take 7130. In the next term, you'll take 7140, and that constitutes the first year. And then going into the second year, you'll start off with probably 2 courses, so 7250 and 7270, and then 7260, and then ending with 8280. So that's how you would organize 8 courses in 2 years. You'll also see in this table, there are these cells in gray, they're called additional. So what this means is if you look at the very first course in the list, 7110, you'll see that it's offered in the first year every term, so January, April, September. And in the second year is also offered every term, January, April, and September. So what this means is that some courses are offered all the time, other courses are offered twice per year, and certain courses are offered once per year. So it's a very kind of designed, the schedule is by design, but it means that if you miss a term or you miss a course or you wanted to even accelerate your studies or maybe take a term and off and then come back, there's enough flexibility in the schedule where that you kind of mix and match according to your needs. The program is kind of designed around a January start, but obviously people start actually in April and sometimes people start in September. So you can count on having a planned schedule that you can align with and then maybe take some more or go a little slower to be in sync with the annual schedule. The program is kind of cohort based, so getting to know other people is very helpful. People connect in LinkedIn, they have relationships in terms of their professional interactions and other things related to studies. So in addition to juggling a day job, studies, and maybe family, people can stay in touch to network professionally. In terms of the budget for the program as a student, it's around $8,128 spread over a 2-year period. Textbooks vary in the courses. Sometimes we have some open source texts, sometimes there's no text. And for the first course, there's extra resources there. So it's a little higher in terms of the textbooks, but it averages around $75 per course for a total of $81.28. In terms of the costs, just kind of doing some comparison between the BCIT Advanced Certificate and other programs. If you think back to your undergraduate studies and think about like a cost per course or a cost per credit, BCIT's Advanced Certificate is going to be around twice the amount of that. So we call this a 1x, whereas the undergraduate would be like around 0.4, so half. And the reason is because in that level of study, when you're doing your first credential, you're kind of sensitive to the time in life that you're at, and it's kind of a public obligation to subsidize those studies with tax dollars. So, it was a kind of a different time at that point in life. By the time you're a working professional, the advanced certificate kind of fits into most people's budget pretty well. There's also programs like the UBC's Executive MBA program or some other executive level programs. Those tuitions on a price per credit basis is usually 2.5 to 3 times higher. And the reason for that is they are very premium products with kind of an exclusive kind of experience. So it's kind of a different sort of niche. BCIT's focus has always been to be highly accessible and to be really sort of like a rising tide lifts all boats sort of perspective. So we really do want to reach out to a broad audience so that everyone can participate in the advancement of the health system as leaders. In terms of expectations, we have these two notions of how students progress through the program. There are students, we call them as accepted into the program. These people are kind of on our short list when there's some important, really interesting or useful information. Let's say there's a discount to a conference or some other opportunity for mentorship. We would reach out to these students and say, hey, there's a mentorship opportunity coming up, consider adding yourself to the list, because these students are in our program. There's also students who are taking individual courses a la carte, not really in the program, but they are BCIT students, but they're not in the program. So in those cases, it's much more difficult to communicate with those students because they're not really on our short list. So there's different levels of involvement that you can have with our program as an accepted student or as an undeclared major. As an accepted student in the program, it's really important to hit the milestones. So after you get into the program, make sure that you start your first course pretty soon, like within the first 6 months of being accepted. Try to get to your all 4 courses completed within the first 12 months. Get your statement of completion to just kind of pat yourself on the back that you met the halfway point, and we'll do the same for you. And then start thinking about the third milestone. So start thinking about an integrated project topic. Think about project topics. What are the pain points in your organization? Who might be a kind of a good sponsor? And get in touch with the department. Have a conversation on how do you prioritize, or maybe even how do you look for potential projects. And milestone number 4 is finish all 8 courses within the 2-year period. Get the advanced certificate. And if you're kind of not sure if you want to do the whole program, or you just really needed that particular course, you can go ahead and take those courses as an undeclared major. But it's still advised to have a call with the department, have a conversation on what your goals are, maybe to refresh your intentions and to be clear on, do you want to do the program, or did you just want to do that course? Next steps. All right. So to get more involved with the program, you can apply to the program. Admissions is done throughout the year. Courses begin in January, April, and September. Applications are done all year around. There's a program advising department who are very helpful to help people kind of get their documentation organized and ready to get into a program like this. As well, on our department website, we have a request for an assessment page, which is basically a very informal, here's some information about me, am I a good fit for the program? And I will write back to you to let you know and give a few tips. So that's very informal, and we have some newsletters that you can sign up for. Okay, so some excerpts. I'll read some of these out rather quickly. I'm an X-ray tech, Vancouver Island. It's easy to get caught up in your own specialty. Looking forward to hearing from different backgrounds. This person provides technical expertise, 30 to 40 people, being a lab tech for 12 years. Next slide. I interact and preceptor and mentor new students and nurses and students. This one's interesting. Person is sort of lamenting how interesting it is and challenging, kind of a new person in the field, but also the youngest in the department and finding themselves in a leadership role. So how do you lead without really clear authority or direct authority over others? How do you lead without authority? This person is cross-trained, has financial background, but is now a pharmacist. Interesting how to mix those two perspectives, the administrative side and then the clinical side, and so on. Young leader who now supervises people who've been in the field longer than they have. So you get the idea. Okay, anything else? Great. Okay, good. Great. So we're at the questions and answers section. I hope you got some insight as to the program from the presentation. We have a few minutes, I think, for Q&A, about 10 minutes, right, Darren?
Actually, we've gone over 45 minutes, but that's okay. We can fit in a few questions.
Okay. I'm going to take a look at the chat to just read some of the questions to myself. There's a question around financial means to offset the cost of tuition. Let's see, what else do we have here? Question about international credentials. International credentials, financial offset. How many applicants do you accept every year? Around 20 per year. For course, I want to check the availability waiting period. Okay, so I'll answer each of these. For the financial one, because this program is intended for working health professionals, it's a different sort of offering than for an undergraduate learner who is just getting started into a career, they're 20-something-year-old. For those ones, there's usually some financial sort of, bursaries and things like that. For this level of study, there isn't usually so much. But if you're part of a professional body, you might want to check to see if there's financial support from the professional body, or if you're part of one of the collective like unions, then see if there's any financial support from that perspective. So more from industry than from government. The question about international credentials, we have a process for doing that at BCIT. It's a little complicated to explain here, but if you email us, we can get back to you and kind of give you like the quickest route as how to get through that. In terms of course availability, courses are offered 3 times per year, but like I said in that schedule, they're not all offered all the time. So certain courses are offered at certain periods, and then the window to register for courses opens about 2 months before to about a month and a half before. So the registration window opens, you can register for courses, and then courses start and the registration window closes until the next cycle begins. So I think I've answered all the questions that were posted in the chat. Darren will be sending out, or BCIT will be sending out the slide deck for all of you who participated. And this video will be recorded and put on the website so that you can re-listen to it later. If you want to get in touch with the department, contact Victoria Danham or myself, Shannon Chataglu. Our shared email address is there, as well as the website.
Thank you, Shan. That was great.
Can I just add one thing? Sorry, before.
Please do.
I did look up on the website about the World Education Services Evaluation Report. I've heard this in some sort of some sort of event at BCIT, and there is nothing on the website about it, so that person will need to contact program advising directly, and they will be able to tell them whether this substitutes for the ISIS report. You need to go directly to program advising, because at the department level, we don't know the answer to that question.
Okay, and I just put up program advising's information. You can go to bcit.ca/advising, and they have the most up-to-date information regarding availability, and they can help you with all kinds of questions about the application process and student resources and success strategies and program schedules and many other things. So they would love to hear from you. If it's a program specific, like Shannon Victoria said, hcm@bcit.ca would be great. And of course, us in the School of Health Sciences would love for you to connect with us on social media. So Meta or X or YouTube, TikTok, and LinkedIn. We'd love to hear from you. And also you can learn a lot more about the school as a whole, BCIT, if you visit bcit.ca, and you can find out about tours and big info and of course advising. So that's our time for today. I just definitely want to thank you all for being with us, and we wish you all the best in your future in health sciences or leadership or whatever you choose. And we really appreciate it. Have a good night, everybody.